Today I will present the CCH experience with the pediatric lymphoma. The malignant pediatric lymphoma accounts for 10 to 15% of all pediatric cancers. Its peak incidence occurs between 5 to 9 years. Hodgkin disease represents 40% of lymphomas in children. Non-Hodgkin lymphoma presents 60% of pediatric lymphoma. Chemotherapy is usually the first most common mode of treatment, and the choice of the treatment and prediction of prognosis depend on the histological type of tumor, initial staging, evaluating tumor response, and detection of early. Conventional imaging modalities play an important role in evaluation of pediatric lymphoma. However, they have their major limitations. PET-CT is proved to be more accurate. So far, the literature lacks reports of large groups of patients in pediatric. The aim of this study is to report the role of PET-CT in pediatric lymphoma at the new established children cancer. 106 PET-CT studies for 74 patients with histologically proven malignant lymphoma were included in this study. There are 19 girls and 55 boys, 51 with Hodgkin disease, 23 with non-Hodgkin disease. Their age ranged from 3 to 17 years. According to the indication for PET-CT, the population was divided into groups. First group PET-CT was performed at the time of diagnosis as part of the initial staging. This group included 16 patients and all of them had Hodgkin disease. The second group PET-CT was performed during the treatment to evaluate the early response to therapy after 2 to 3 courses of chemotherapy. 23 patients were included in this group, 18 with Hodgkin disease and 5 with non-Hodgkin. The third group PET-CT was performed 4 to 6 weeks after completion of treatment to evaluate the disease status. 23 patients are included in this group, 10 with Hodgkin disease and 13 with non-Hodgkin lymphoma. The last group PET-CT will perform 3 to 6 months during follow-up of patients in complete remission. A total of 12 patients are included, 6 with Hodgkin disease and 6 with non-Hodgkin. Coming to the methodology, considering the PET imaging, patients fasted for at least 4 to 6 hours prior to examination. Blood glucose level was measured and was lower than 120 milligram deciliter. Patients' weight ranged from 9.5 kg to 79 kg with mean weight 32. Acquisition was started 45 to 60 minutes after intravenous injection of 1 mercury per 10 kg body weight with a minimum dose of 5 mg. Whole body scans were acquired in overlapped bed position, usually from mid-thigh to base of skull, 3 minutes for each bed position. Images were reconstructed by iterative reconstruction. Attenuation correction was applied in all the scans by means of low-dose CT. All patients except 6 were imaged without sedation. Coming to CT acquisition, CT was performed either as a low-dose CT for attenuation correction and anatomical localization or high-dose CT for diagnostic purpose based on the CT adjusted milliampere. Oral contrast was given in 31 patients in 31 studies, while IV contrast was given in 86 studies according to the requirements. The sensitivity, specificity, accuracy, positive and negative predictive values of PET-CT and conventional imaging modalities were compared. In the first group, referred for initial staging, PET-CT and conventional methods were concordant in 10 patients out of the 16 patients. PET-CT upstaged 2 patients out of 6 from stage 1 to stage 2, 1 patient from stage 2 to stage 3, and 1 patient from stage 3 to PET-CT downstage 2 patients, 1 from stage 4 to stage 2, and 1 from stage 3 to 2. Quantitatively, maximum SUV of the lesion ranged from 3.8 to 5.1 with mean SUV. PET-CT thus modified the staging and treatment option in 6 out of 16 cases. It means 37.5%. Upstaging 25% of the patient and downstaging 12% of the patients. Coming to the second group, for which we are assessing the early response to therapy, it includes 23 patients with 32 studies. Here we see that the PET was positive in 5 patients. 4 of these 5 were true positive, and the 18 negative, all of them were true negative. On the other hand, the conventional imaging modalities, 8 were positive, 3 of them were true positive, and 5 were false positive. And considering the 15 negative with conventional imaging, 14 were true negative and 1 false. In the third group, for which we assess the treatment response late 3 to 8 weeks after the end of therapy, we see there are also 23 cases. The PET-CT showed 6 positive cases, 4 of them were true positive, and 17 negative cases. All the 17 were true negative. On the other hand, the conventional imaging modalities, 10 positive, 3 are true positive, and 7 false positive. And the 13 negative studies, 12 true negative, and 1 false. The fourth group, in which we determine the long-term follow-up, concordance between PET-CT and conventional imaging modalities was found in 8 of the 12 cases. 4 cases were true negative and 4 cases were true positive in both PET-CT and conventional imaging modalities. Discordance was in 4 out of the 12 cases in which PET-CT was true negative and confirmed by other follow-up study after. And here is the table showing us the sensitivity, specificity, accuracy, positive and negative values of PET-CT and conventional imaging modalities. We see that the sensitivity of the PET-CT in all the 3 groups about 100%, with negative predictive value also about 100%. Coming to the accuracy and the specificity, there is much higher percentage for the PET-CT than the conventional imaging modalities. The accuracy for the PET-CT ranged from 91 to 100. In comparison to the conventional imaging modalities, that is between 66.6 to 73.9. Coming to the specificity for the conventional imaging modalities, it ranges from 50 to 73.5. On the other hand, that for the PET-CT is 95 to 100%. And here we come to the case presentation. Our first case is 12 years old male patient with stage 3 Hodgkin disease. Initial CT revealed mediastinal, cervical, and abdominal nodes. Accordingly, he was classified as stage 3 Hodgkin disease. He was scheduled for PET-CT as a part of initial staging. PET-CT showed multiple focal metabolically active lesions over the dorsal vertebrae, right iliac and right femur. And here we see the lesion in the dorsal vertebrae and in the iliac bone. Accordingly, he was upstaged to stage 4. After 3 courses of chemotherapy, he was then referred for PET-CT to assess response to treatment. Follow-up PET-CT showed almost complete remission of the previously denoted metabolically active, confirming that these lesions are of lymphomatous origin. We see the post-therapy scan, almost complete remission of the previously noted lesion, and here is the pre-therapy scan. In the comparison, almost complete remission of this lesion. The second case is for 13 years old male patient with Hodgkin disease, stage 3B. Initial staging CT revealed cervical, abdominal, and pelvic lymph nodes that the patient was classified as stage 3, having supraanagmatic nodes. And here is the CT showing multiple cervical. PET-CT then revealed that the only metabolically active lesions are those of the right iliac nodes, while no supradiaphragmatic nodes, no active supradiaphragmatic nodes, thus downstaging the patient from stage 3 to stage 2. And here we see that the cervical lymph nodes are not active, and in the co-registered image, no activity appears on the cervical. Here are the inguinal lymph nodes. Intense FDG uptake are seen on the inguinal lymph nodes. The third case is for 12 years old male patient with Hodgkin disease. Initial CT revealed bilateral cervical lymph nodes with no other lesions. He received 3 courses of chemotherapy and scheduled for PET-CT to assess treatment. PET-CT revealed complete resolution of the previously CT denoted cervical nodes with new pathological lesion of left inguinal region, thus upstaging the patient and shifted him to second therapy. And here we see the intense uptake over the small left inguinal lymph node. And here is a sonographic evaluation after the PET-CT showing that iliac lymph node. The fourth case is for a 9 years old male patient with Hodgkin disease. He finished 6 courses of ABVD chemotherapy. 6 weeks after therapy, he was scheduled for PET-CT for CT neck and chest, as well as PET-CT to evaluate treatment response. CT revealed small residual cervical nodes as well as 3 suspicious nodules. And here is the pulmonary nodules which are suspicious in the CT. PET-CT showed no abnormal FDG that could account for metabolically active lesion all over the cerebral body. The patient was then kept under follow-up with no evidence of disease relapse for 6 weeks. Here is the co-registered images. The radiological demonstrator or the CT demonstrated nodule with no uptake at all in the PET-CT. fifth case for 6-year-old female patient has been diagnosed as Burkitt's lymphoma of the intestine. Initial CT revealed thickened ileal loops with multiple mesenteric lymph nodes. She received 6 cycles of chemotherapy. Post-therapy CT showed regressive course of the thickened bowel loop, but still residual in the distal loops. PET-CT showed a mass in the distal bowel, highly suggestive of lymphoma, no other metabolically viable lymphomatous lesion. The patient underwent surgical excision of the distal ileal loops of the intestine, and the patient revealed suppurative inflammation. Here we see the intense tracer uptake over the radiologically detected mass that after excision revealed that it is suppurative as malignant cells, and here is the pathology confirming that it's abscess when there's no evidence of lymphoma. And this is one of the examples of the false positive results of the PET-CT. Coming to the conclusion, current study shows that the importance of FDG PET-CT as a useful method in the management of pediatric lymphoma. It showed great value in initial staging of lymphomas with changing staging in 37.5%. PET-CT has significant implication in the terms of assessment of treatment response with higher specificity than the conventional imaging modalities. PET-CT appears to be highly specific and allows for accurate characterization of residual masses, which are not uncommon in the pediatric